Assalamu alaikum. Uh, Today, I have to discuss the very important topic regarding introduction to clinical pharmacy and how to read a patient file for the pharmacy interns currently doing their internship at National Institute of Child Health. So, for your ease, I have prepared a slide, a presentation, in which I have prepared some slides, which in which we discuss the regarding topic about the clinical pharmacy and what are the important aspects to review the patient file and record the vitals, the monitoring parameters, the treatment and the protocols regarding the diagnosis and patient condition in your logbooks. So, few points I have to discuss here. Now, objective of this presentation is what is the clinical pharmacy, what are the goals for clinical pharmacy, who is a clinical pharmacist, and what are the roles of clinical pharmacist. After that, I have to discuss how to read a patient file and how many a clinical pharmacist intervene. Regarding the topic clinical pharmacy, the definition is defined from the American College of Clinical Pharmacy, and they say that the clinical pharmacy is an area of pharmacy concerned with the science and practice of rational medication use. The rationale is the correct medication use, not incorrect, not inappropriate. So, rationale is basically defined the appropriateness or the correctness of the medication use. The goals of clinical pharmacy, if we see the clinical pharmacy objectives are work with other healthcare professionals for better treatment. That is, there is a liaison between the healthcare professionals, including physicians, consultants, nursing attendants, nurses, dietitian, and if there is involvement of radiological staff or laboratory staff. So the pharmacy, the basic objective of the clinical pharmacy is to work with other healthcare professionals in a in its horizon for better treatment to provide the better treatment protocol. Next is maximizing the effect of drug therapy. Whatever the drug selection, it should be the right choice, it should be the appropriate, and with the appropriate dosing, with appropriate frequency of the drug, with appropriate dilution, with appropriate compatible solution, and with appropriate infusion rate. So if the rationalization is okay, if the appropriateness is okay, then we have to maximize the drug therapy, the effect of drug therapy. So it is the goal of clinical pharmacy. Another goal is minimizing the side effects. Yes, there is another aspect of the use of drug that it may produce the side effects, the non-desirable effects, which may be harmful to a some extent to the patient by the use of drug. So, pharmacist, the clinical pharmacy goal is to achieve the maximum therapeutic outcome with minimizing the side effects, with lower or lesser side effects. If the patient has non-desirable effect along with the desirable effect, then there is a role of clinical pharmacy to counsel the patient, to enhance the patient compliance, which is again the another objective, another goal. You may see increase patient compliance by counseling, by intervening in the during the therapy, during the treatment plan, and by a negotiation between the physician and the nurses and the patient or their attendant, how to use the drug and how the medication becomes safe and effective with the minimum cost. The another goal of clinical pharmacy is minimizing the cost of the therapy. It is very important that clinical pharmacy works on the pharmacoeconomics plus as well as pharmacovigilance. So these are the umbrella of the goal of clinical pharmacy in which a clinical pharmacist practice on these objectives. Now, who is the clinical pharmacist? A pharmacist who work directly with the physician Basically, the students, most of the time, when I ask who is a clinical pharmacist or what are the role of clinical pharmacist, they say that clinical pharmacist is a person who directly work with the patient. Basically, not only the patient but with the physicians. He is a part of healthcare team. So pharmacist is a person who directly work with the physician, with the other health professionals, including, I have already stated, that the nurses, the paramedics, the dietitian, the radiologist, the lab technician. So, other healthcare professionals who is involved in the treatment of patient care, who is involved at the point of care to the patients. So, yeah, pharmacist is also the essential part of this healthcare team, and he directly work with physician and these personals as well as patients to ensure the medication prescribed for patient contribute to the best possible health outcome. So there is a very important and significant role of clinical pharmacist, which is undeniable, that the pharmacist is the person who make the confidence over the medicine, who prepare the patient to take his treatment on and care of about his well-being, and make sure that the physician prescribe the right doses, the right medication, the right prescription, and nurses perform their duty at the right time and with right documentation. So a key role of pharmacist, which is undeniable, which is necessary, which is not to be neglected or not to be ignored in the healthcare area, healthcare settings, whatever it is, the clinics, the hospitals, or the community. Come towards what a clinical pharmacist do. A clinical pharmacist can do lot of things, in which number one, assess patient's health and prescribe medication, not only assessing the patient health but also the prescription in which the medications are written down. Next one is evaluate the appropriateness and effectiveness of medication. Yes, this is the very important task which a clinical pharmacist can do, is the evaluation. And evaluation is what? Evaluation of the medication, how appropriate it is, how rational it is, how effective it is, how safe it is. Another task which a clinical pharmacist can do is to recognize untreated health problems that could be resolved with medication. Identify the other outcome, the beneficial one or the harmful one of the related with the health of the patients, that could be resolved with medication, a minimum medication or a minimum precaution or a caution, or some domestically remedies, some domestic remedies, or with some medication which should be prescribed in the medication prescription. Another is follow patient's progress. Yes, it is very important. If a clinical pharmacist can't do this, can't follow up the patient, the whole patient criteria, which is very important to give the best health outcome, at that moment should be halted or should be stopped if the follow up is not taken by the clinical pharmacist. So, patient progress, note down the patient process, documentation of the patient process, their follow ups are very important. Another is consult with patient, physician, and other health professionals. This consultation is very necessary among the physician and other health professional to negotiate. I have stated earlier, to negotiate, to understand, to share the knowledge, to learn about the medication, to learn about the diagnostic parameter. It is very important because you are the person who directly counsel the patients, who directly counsel the patient attendant regarding the disease state, regarding the medication, regarding the treatment protocol, regarding the therapy duration, regarding the cost effectiveness of the medication. So it is very important that you have to consult a minimum minor things regarding the patient health or patient disease or their prognosis with the health professionals. Another task which a clinical pharmacist can do is the consult patient on medication use. This is the point of counseling. and educate patient about non-pharmacological steps required to improve or maintain health. That is how to maintain their diet, how to make exercises regularly, and how to quit smoking and alcohol drinking, which is harmful to the patient condition. So these are some terminologies which should be clinical pharmacists can do with the patients. Refer patients to physician or other health professional. If anyone come to you and describe your health concern, you have to understand the whole thing, and then finally you are the person. If he or she has a confidence in you, you are the person to counsel him to refer the physician in the severe condition, or other health professional, that is the consultant, the gps, or whatever the medical officers available at that moment in the community or in the hospital. So you are the person who well educate the patient regarding their health concern and refer to the desired healthcare settings at the outpatient department or emergency, or if you have seen the patient condition is serious, uh, you are the person who consult with the consultant, with the special consultant, and refer to the patient there. So these are the clinical pharmacist are the task which can do easily. Now, role of clinical pharmacist is a picture I have observed in previous days at Google, and it is like look like a good, and in the sense that it covers it. It shows the brainstorming of the clinical pharmacist, the work area, the roles, the objectives, and it is very precise and concise. So it is very important. If I show you the important aspect of the role of clinical pharmacist is number one, ward round participation. That is during the round of the healthcare staff, clinical pharmacist should be the part of the provision of drug poison information, that is DPIC, drug poison information center. If the hospital has a setting of DPIC, then you will be the part of it. But if not, then you are individually work on the drug poison information, that you must have known about the poisoning and its treatment. The clinical review, again, the whole profile of the patient comes under the umbrella of clinical review. The monitoring and reporting ADRs, which I have to discuss later in the forwarding slides, that monitoring the ADRs and reporting the ADRs is also the important aspect of clinical pharmacist. The community service clinical pharmacy not only comprises on clinics or on healthcare setting, but the community services are also provided by the clinical pharmacist at the same time. And it is very important to clarify this objective, that clinical pharmacist should work on the community. If it is not, then there is a burden of disease on hospitals. If the community is not aware regarding the disease or the medications or the healthcare concerns, then community has a wide spread of diseases, had a wide spread of infections, and it ultimately produce the burden of disease on the primary, secondary, and tertiary care healthcare settings. So it is very important that the clinical pharmacist should work on the community services. Again, there is another aspect is TDM. TDM is therapeutic drug monitoring. Therapeutic drug monitoring associated with the drug levels, the plasma peak levels of the drugs, and the concern basically about the toxic drugs. The high doses become toxic. Those drugs are should be monitored. For example, aminoglycosides. Another aspect is prevention and monitoring DI, that is the drug interactions, drug interaction prevention, and its monitoring is again the job of clinical pharmacist. And patient counseling, it is very much discussed in the previous slide. Medication history review, an important point. If you know the patient medication history, you very well know how the hypersensitive reactions occur. You know the drug allergies. You know the previous treatment protocol, which will be effective or not, and then suggest the physicians or consultant about the new treatment or the new prescription at that moment the patient receive with the presenting complaint. The optimization of therapy, that is the maximum output, maximum therapeutic outcome with the maximum benefit and the minimum risk with minimum risk, that is with minimum side effects. And the last and not least is clinical research. Yes, the clinical pharmacist is the person who should involve in the clinical research at the level in which the patients are involved by giving some medication. So it is very important and significant role of the clinical pharmacist in the healthcare setting. Now come towards your objective. Your interesting point is how to read a patient file, especially at NICH. How to read it? The patient file have many parts, and you have to assess these parts with the important one which are useful for you, and the related parts are used to assess the patient condition and their follow-ups, while the unnecessary parts, if not monitored, is not necessarily to report on your logbooks. So what are the important part of the patient file? First part considered as demographics. Demographics include the patient name with its father name, the MR number, the registration number which the patient attend at the registration desk at the time the patient admitted at this hospital, the date of admission, age. If reported in months, then you have to report in months. If reported in days, then you have to report it in days. And if reported in years, you have to report it in years. The gender, either a boy or a girl. Weight, most of the time it is reported in kgs, not in pounds. Height, most of the time it is reported in centimeter, not in inches. The BMI, and the vaccination status. These are the required demographics, which is very important to note for each and every patient, as most of the time, majority of the time, the drug dosing should be calculated with the weight or height. So it is very important. And sometimes the age, with the age. So it is very important to note all these identification marks and the demographic, the basic characteristics of the patients. Now examination, another part of the to read the patient file is examination. Examination is related with presenting complaint, that is in which complaint the patient admitted at the hospital, although the fits and fever, the MSs, the diarrhea, the unconsciousness, if the accident also high grade bleeding or whatever the fracture. So the presenting complaint is very important, and it is the very first and most important part of the examination, that is called physical examination. In presenting complaint, you should note the patient comes at ER or at OPD, at what time and what happened to the patient. Okay, and then physical examination include four important parts which shows the at which level of the patient needs the treatment or needs the if there is an emergency, if there is sustainability, if there is some kind of stability. So these four important CNS, if it is GS scale, Glasgow scale, how much conscious the patient is or not, the abdomen, if there is edema or not, chest, if there is shortness of breath or edema or not, and CVS, that is the cardiovascular activity, their notes. So these four parts are very important in physical examination at the time at which the patient receive at ER or OPD. So these points should be mentioned at the first page of the patient file. And I repeat that the time at which the patient receive at the hospital through OPD or through ER, what happened at what time, at that moment, what is the condition, what was the condition of CNS, what was the condition of abdomen, chest, and CVS. So these parts are very much clearly written on the patient file. Come towards the patient history. Next is patient history. Once you receive the patient, once you admitted the patient, once you take the physical examination. Now you should take the history of the patient. Okay, either the patient is currently diagnosed, currently have a presenting complaint, or have some past medication, have some past disease history, including the hypertension, including the blood pressure, including the TB, that there is a typhoid profile, or the patient is asthmatic or not. If there is any disease, then there should be a medication history. So you should note the medication history. And the very important part of the patient history is the family concern. That is, the family is from which economical status. That is the socio-economic status regarding the lower class, the middle class, the lower middle class, either employed or unemployed. And another family history concern is that the marriage between the parents is consanguineous marriage, that is between the cousins, or between the family, or apart from the family, or the patient is the outcome of uh, how many siblings of the patient, and patient is at which position, at which position the patient has their number. So how much family members are there, how many siblings are there, and the patient is the first outcome of the marriage, or the second, or the third, or fourth one. So this is very important. Again, in family history, you should note if there is any disease condition in between the family, that is the hypertensive, the diabetes, the asthma, the TB problem, in mother or in father, or you may also report the thalassemia. So these are the important part in which you can assess the patient condition during the treatment also, and during the diagnosis also. Although the diagnosis is not your part and not your concern, but diagnosis is basically for the physician, concerns with the pathologist and radiologist. But you should know the basic parameters, the basic characteristics of the patient, and the final diagnosis made by the physician, so that you should concern the treatment protocol. The vitals which are very important to note about the patient condition is temperature. These are the daily recordings, and you should note down on the daily basis. If you are in the ward, on in a weekly basis, and you follow the patient on the first day, and you will see the patient stay for 3 or 4 or 5 days at that ward, then you should note the temperature on daily basis. You should note the blood pressure on daily basis at a single time. You should note the respiratory rate on daily basis on a single time. If you are present in the ward at 8 a.m. and you note the temperature, blood pressure, respiratory rate, it's okay. It's okay at that time. And now you report in your logbook the temperature, blood pressure, respiratory rate, pulse rate, or heart rate on next day by making a column. Okay. Next is subvital. Subvital reported at once. Okay. And it is reported in the patient file as acronyms, that is A stands for anemia, J stands for jaundice. If there is a 1 plus with A plus, then it means the anemia is observed, and it is a minor. If A has 2 plus signs, A plus plus, then there is a moderate anemia. And if A has 3 plus sign, that it is a severe anemia. So these are the subvitals which is reported in the patient file with plus or minus sign. If there is plus, then it is positive anemia. If there is a minus, then there is negative anemia. So A minus stands for no anemia. Plus stands for yes, anemia is there. If 2 plus, the anemia is moderate. If 3 plus, the anemia is severe. So these are the acronyms with plus and minus signs. A anemia, J jaundice, CY stands for syncope, CL stands for clubbing, D stands for dehydration, and E stands for edema. Now come towards after these, the subvitals, vitals, physical examination and medication history or the past history. The lab reports are very important, which at the moment of ER or OPD, the patient blood collected by the lab person, and when the patient comes or enters at the ward, few lab reports are mentioned, are available with the patient file, including the CBC, which is very important regarding the hematocrit count, hematocytes, the leukocytes and thrombocytes. The another report which is very important during the treatment of the patient at the hospital level is electrolytes, and electrolytes include the sodium level. You should know the baseline value of the sodium, the maximum and minimum range, the potassium, calcium, magnesium, chloride, phosphate, and bicarb. These electrolyte basically very much the treatment depend on these electrolyte balances or imbalances. In most of the cases of diarrhea, the electrolyte imbalance has also observed, and in most of the cases of fits and seizures, the electrolyte imbalance is also observed. Most of the time, there is no electrolyte imbalance at the time at which the patient received at the ward or hospital, but during the treatment protocol, some medicines have a side effects on the electrolyte. So electrolyte imbalance have also observed during the treatment. So it is very important to take daily monitor the electrolytes on daily basis, or sometimes 2 times in the day. The renal function test is very important. It includes the blood urea nitrogen, and serum creatinine. The renal function test basically shows the kidney function, and if the kidney function is not improvised, then you should adjust the doses according to the renal function. The liver enzymes are also important depending on the patient condition, and ALT, AST. Along with ALT, AST, the PT prothrombin is also important. The cardiac enzymes shows the cardiac activity, the troponin and CK. The CRP, basically CRP is a C-reactive protein, and it shows the level of infection in the body. And if it is very high on the high ranges, it shows the patient is has become sepsis or has a septic shock. Sepsis is basically related with the multiple organ infection. So, if the patient comes with a urinary tract infection, he or she may develop respiratory tract infection at during the treatment at the hospital by adopting the nosocomial infection of pneumonia, or may progress in disease by admitting at the hospital due to poor sanitation, due to poor infection control schemes, and with the contact or to other patients, the patient condition getting worse, and uh, it may be progress towards the sepsis or sepsis condition. So at that point, the marker of CRP is very important to notify this infectious condition. And laboratory reports also reveals the blood sugar level. Sugar level are important for the choice of dilution, for the choice of stable compatible dilution infusion, basically the normal saline or dextrose. If there is sugar levels are high, the patient, the consultant or physician should not choose the should not choose the dextrose solution to um, for the dilution of the medications. The next is, and very important, is diagnosis. Very important for clinical pharmacists, because if the diagnosis is not the concern, then you are unaware of the patient disease condition. You randomly select the symptoms of the patients. That is, there is some diarrhea, there is some you may call the emesis, you may call the fatigue, you may call the fever, you may call it the cardiac instability, you may call it conscious unconsciousness, you may call it seizures, but the complete diagnosis, the full diagnosis is not mentioned, is not reported, then the clinical pharmacist not to go towards the treatment plan. So diagnosis is the base for treatment plan, and diagnosis is the given the opportunity to study the treatment protocol. to the clinical pharmacist. Yes, this is very important and the basic part of the clinical pharmacist regarding the treatment. Uh, treatment basically requires the medicine, and the first medicine at the time of admission of the patient is anti-infective, that is the third generation cephalosporin at the time of emergency. If the patient is not diagnosed, if the patient is not treated, but there is a protocol at each and every emergency department of the tertiary care hospital that at the moment patient received, it should be past the IV line, and through IV lines, the third generation cephalosporin is the first choice of the patient who would come at the ER department. So anti-infective therapy start at the first day of the patient come at the hospital, and now here you receive the patient at ward, and here the ward you may check the anti-infective therapy is empirical, the therapeutic one, or prophylactic one. The empirical therapy includes that if the patient received the anti-infective therapy without the culture sensitivity test, then this is called empirical therapy. If the patient received the anti-infective therapy after the culture sensitivity test, and the microbes are identified and the sensitivity are identified, then it is called the therapeutic treatment. And the prophylactic treatment known as before the surgical procedure, when before the surgery, when uh, before almost about an hour of the surgery, that anti-infective protocol should be given, so it is called prophylactic. Another one, that is symptomatic or therapeutic. You may also observe the treatment in during the treatment the anti-infective, which anti not only an anti-infective but whole regime of the drug which the patient receive at the time of admission of the at the time and during the treatment. The patient is therapeutically controlled or the symptomatically managed. Sometimes the patient, uh, till the diagnosis is finalized, the patient is symptomatically managed, and not the treatment, not the exact treatment is given to the patient until and unless the weight of the few lab reports, the waiting of the radiological concerns are necessary till the final diagnosis is made. So it is very important to note that here the patient receive the symptomatic management or receive the therapeutic protocol, receive the therapeutic treatment protocol. Again, during the treatment protocol, you have observed the dosing. First of all, the selection of the drug in which you consider it is empirical, prophylactic, or therapeutic, it is symptomatic or therapeutic. That is, the selection of the drug is appropriate or not, the choice of the drug is correct or not. There is the rationale of the drug, that is, this drug should be given in the patient at that moment or not. So first, you observe the rationale, the selection, the choice. If the selection is correct, it is appropriate, then you should check the dosing of the treatment, dosing of the drugs which is given to the patient. And in pediatric concern, you are very much I have to say this that in pediatric concern, you should know the safety of the drugs. So you should know the this drug is safe or not, and at which doses it is safe for the pediatric patient or not. If the doses are high, this high doses will become toxic and produce the toxic effect or the fatal effect to the patient, the harmful effect. Maybe it become the cause of mortality. So it is very important to note the doses of the drug. In pediatric, the dosing guideline is very much different to the adults. Next is frequency. Frequency is, the frequency, that is 6 hourly, 8 hourly, 12 hourly, or once daily. And you know the acronyms, the OD, the BD, the TID, and QID. If there is any problem, you may ask at any time. Now the other is dilution and rate, that is the how much, which compatible solution is for the medication for this drug, and how much diluted, and what is the infusion rate. So this is another science of clinical pharmacy basically. and you are very much concerned about the compatible diluent, the volume of that diluent, and the time at which the during which that this volume should infuse to the patient. So every injection should not be IV bolus, but it should be, and most of the time the diluted medicine should administer within 30 to 60 minutes to the patient. Or sometimes if the injection is directly without any dilution, it is that only the reconstitution and then directly inject in the IV line, then it should be passed slowly and within the 5 minutes, not more than 5 minutes, not less than 3 minutes. So IV bolus is not prescribed at any moment, uh, with few exceptions, but most of the time the drug is infused slowly at a some rate. So it is very important to have a knowledge about this. Then other is interaction and contraindication, the drug drug interactions, the drug food interactions, the drug disease interactions. So these are the kinds of interactions, and you should know the drug drug interaction basically, especially the metabolisms, especially the absorption level, and especially at the distribution level. So kinetics is involved here, pharmacokinetics. And if you know the drug kinetics regarding the absorption and metabolism, which is very important to know about how which drugs are hepatically metabolized, and basically by the cytochrome P450 enzyme system, the cascade of the CYP450, most of the drugs are metabolized by CYP3A4, and the drugs which are metabolized by CYP3A4 are drug have a serious drug drug interaction, the severe one. Now, and you have also know about how to minimize these interaction by giving by giving the drugs through separate IV line, by changing the route of the administration, by changing, that is one from the IV and one from per oral, or by changing the time at which the drug administered to the patient, by changing the frequency of the drug administration, by changing the doses of the drugs. So you should know the interaction, and you should to also have a knowledge about the avoidance of these interaction. The another one is contraindication. Some drugs, fewer drugs have a serious and serious and a very concern interact contraindication, that is the ceftriaxone should not given with the calcium containing salts. So this is a very fatal combination. If the ceftriaxone is given with the calcium salt, so patient get ultimately death. So the contraindications, so few, these are fewer or lesser, not in a wide range, but you should know during reporting the patient's file, you should know the contraindication. So the so you are aware at that moment that how to physician prescribe the prescription pattern. The polypharmacy, actually when the patient is admitted at the hospital with serious concern, and in the cases of tertiary care there is some uh, there is fewer complication with along with the disease of the patient, and you may call that as comorbidities associated with it, and there is a polypharmacy. So you have observed for a patient admitted at the hospital, more than 4 or 5 drugs as administered during the therapy. So this is for polypharmacy, and the clinical pharmacist, as you are doing your internship on the umbrella of clinical pharmacy, so you should know about the polypharmacy and its concerns. Now come towards the last point, that is the pharmacist intervention, where you intervene. If you know all the aspect about the patient file, then you should go towards some fewer more points, and these are the medication error. Medication error, I have told you the medication error are those in which you have observed the appropriate selection, the rational selection of the drug, their doses, their frequency, their dilution, their infusion rate. So these are the medication error regarding the selectivity, the doses, the frequency, and their compatible solution and their infusion rate. Come towards the drug drug interaction. If you know the interactions of the drug, you may report the drug drug interaction, how much they are severe, if they are mild. Physician and pharmacist and healthcare team most of the time ignore, If there is moderate, then physician and pharmacist have a negotiation, have a talk and discussion about it. Okay, these are the interaction and have a moderate kind. So what should be the steps if we have taken either the dosing protocol continued, or if not, then monitoring parameters are required. What are the monitoring parameters? The heart rate, the ECG, the consciousness scale, the GS scale, whatever the required it is, so the monitoring can be affected, or it may reduce the drug interactions. And if the drug interactions are severe kind, so the physician take the step to switch off the drug, or to change the time, or to change the route of the administration. Another one in which the pharmacist intervene is adverse drug reaction. Adverse drug reaction are those which are not reported priorly. Side effects are reported priorly. So you should know the difference in between two. What are the side effects and what are the adverse drug reaction? The side effects are those which are reported priorly, which was well understood by the physician and pharmacist at the time of giving the patient, at the time at which the medication has given to the patient. But adverse drug reactions are those which are not priorly written or understood, or shared by the labeled FDA protocol, or by the manufacturer specs. So adverse drug reaction are most of the time, but majority of the time, are um observed instantly. So you should know the drug reaction, that is the drug reaction, and it is not observed at each and every patient. So depends on the patient prognosis, it depends on the dosing protocol, it depends on the patient, the severity of the disease, the critical condition of the disease. So ADR reporting form available on request at each and every ward. If not available, then you should concern to me at pharmacy department. I will provide you the ADR reporting form. The last and least is therapeutic drug monitoring. If the plasma peak concentration of the drugs monitor these, the plasma peak concentration, the facility of these monitoring, this kind of monitoring is not available on the public sector hospital frequently. So TDM is not possible at NICH, but at other healthcare facilities, the TDM also observed and reported in the patient file, especially by the pharmacist in in the umbrella of pharmacist intervention. So keep learning and keep enjoying the visits of ward at NICH. If there is any query, if there is any other concern, then you should ask on the WhatsApp group or in the comment section, or you may come to my office at my duty hours. And some few lectures are here at the Saturdays. I will share the schedule with you people soon, inshallah. Thank you so much.